All right, so we are 3 years follow-up. Man, it just seemed like yesterday you in my chair, right?
Yep, exactly. And when I was in your chair, it was actually the whole day, but it actually was. It felt like 15 minutes. So 3 years flew by like
Yeah.
it was 15 minutes.
Yeah. So I'm gonna show the audience what Chris used to look like, and that was him. And see, that's right before surgery that morning, and he's a little bit look more mature then. Okay. Go ahead.
You want to say older?
Okay, go ahead. Look at me. And so, tell me what's going on lately.
Well, same thing. Been working and living my life, and the funny thing is that I continue to meet people that actually recognizes me from the area, of course. Like at the gym, I had a guy come up to me and he kept on staring at me for a while, and then finally he came up to me and he said, "Hey, I saw your video, and I just want, I've been to Dr. Diep for a consultation. I'm gonna get it done as well." And he said that I was his inspiration because of the videos, and he said that when he saw me, it was almost like seeing a celebrity, and I laughed, what I mean? And it's
I guess a lot of people recognize you now because of my video.
It is, people that I meet locally, but at first I was kind of like, I remember when I first had my surgery, and then you asked if I wanted to do month to month. At first I thought maybe I shouldn't, but then you know what? To be honest with you, it's not a big deal because at first you might be afraid that people recognize you, but the people who recognize you are the people who have the same issues as you. Basically, they're doing research because they're losing their hair. So there's nothing wrong with that. It's not like
you're helping them out.
Yeah,
really,
exactly.
big time.
It's not like somebody's going to be just looking up hair videos for nothing, and then they see you on the street, go, "Hey, you got your hair done." No, it's people are actually doing research because they need it done.
So,
yeah.
you mentioned about the girl you date recently.
Oh yeah, that's right. So I told you that story about a girl that I went on a date with. Actually, kind of was going out. And then she had a friend from North Carolina, a male friend, and he happened to text her that night and asked her, "What are you doing tonight?" And she said, "Well, I'm going out with this guy." And so he's like, "What does he look like?" So she actually sent a picture of me to him, and it was funny because she forwarded his text over, and he said he looks like he should be in a cover in some magazine or something because he has some freaking effing nice hair. So and he put an exclamation point on it. He's like, he has some freaking effing nice hair. It just made me laugh, So.
Well, that's awesome because you came from losing hair and came from now to knowing as a hair guy, a hairy guy. So that's a good story to hear, and the audience, with hair transplant, it can be done, and sometimes you're gonna need more than one surgery to have perfect density, and not everybody gonna have perfect like Chris every day. I mean, I wish, but here Chris is one of my star patient, and and sometimes you need touch up and sometimes not. But hair transplant, we will never get original density what you God created, but you gotta know how to. I give you the tools, but you gotta know how to do what to do with it.
Style it.
Right?
I tell people that all the time when I meet them. I said, "Hey, you know what? You got a full set of hair now. Play around with it, style it, find the best hairstyle for yourself." And also, here's another point I like to bring up is that you have to be real to yourself and have the right expectations when you come in here, and realistic expectations. For instance, if for example, my hair loss was class 5 to 6, so I knew that if I wanted to do an FUE, it's going to require 2 surgeries.
Or more.
Right?
3.
Correct. Yeah. But I knew that, hey, you know what? If I want to do it in one sitting and get as much as possible, I did an FUT, and I knew that I was going to need probably 5,000 or more, and I was lucky enough to get 5,200 grafts, right? So that's realistic, right? Knowing that, okay, well, if I do an FUE, I'm going to have 2 surgery, and if I have 1 surgery, I'm not going to get a full coverage. And having real expectation is the most important thing. You know what I mean? So that way, when your results come out, you understand that I'm at this point because I need this much or whatnot.
Yeah, and then the story you told me about that guy you saw at a restaurant, and then he would talk about he saw me and then he went and get it done somewhere else.
Yeah.
And then then you touch up to him about. The importance of price and location.
Yeah,
why don't you discuss that with the client,
right.
viewer?
So I met a few people one of them went to a local doctor around who advertised a lot on radio, and I hear his advertisement a lot on radio as well. And the doctor actually, and the guy who approached me, who was African American, and he said, hey, I recognize you, I saw your video on YouTube, Dr. Diep. So we introduced each other and one another, and then we started talking, and he said, look, you know what, I went to this doctor, and he told me that he was going to do a robotic, but his robot was broken. For one, I told him to never do anything robotic, okay? Nothing is better than the craft.
Manual.
Right, the artistry of the doctor's hands, right? And so the doctor told him that, you know what, I'm going to do it manually for you, but we're just going to do 500 grafts to see how it goes. Then I stopped him right there. I go, if the doctor says, we're just going to do 500 grafts to see how it goes, I mean, he has no confidence in his work. You should have just walked away. He didn't, and he got charged, thousands for it, a few thousand, maybe $5,000 for it, and he had 0 results out of 500, 0. So he said that he had to come back to you to get it fixed. So he eventually, again, he did it cheaper or whatever, and now he's got to spend more money to get it fixed. So it doesn't make sense. And people from far away. I have a friend from Idaho that comes out, and he'd been to consultations in New York and all over the United States, but he came here. It's not about the distance or the price to him, because he realized that, he said that, you know what, if it costs me a little bit more, a little bit less, but if it's the right doctor, it's the right doctor, no matter the distance or the price. If you're going to pay for something really cheap, you're going to get cheap results, right?
So in the price and the location is really important, because many other videos they mention that some people go out of the country and those stuff. So number one is the price, because it's, you don't do it just for cheap price. You get what you pay for, right? So that's one. And number two is location. You don't want to go to a guy where he's just more convenient because he's closer to you.
Right.
And you will fly or go or drive wherever it takes to go to the right surgeon to give you the best result.
Absolutely, but I was lucky because I live here. So
I'm in your backyard.
Right, in your backyard. And the 3+ years that I've known you now, since I've done my hair, I've came here many of times, before I did my surgery and even after I did my surgery for follow-ups and whatnot. So like I said, it's absolutely convenient for me, but the distance is not an issue because, buddy from Idaho and Texas, the Idaho guy, he comes over here all the time because, it's not a problem for him because he comes here for consultation, to follow-ups and whatnot, because he wants to make sure that things are done and done right.
Yeah, even if I'm in, England or Africa, whatever, what continent, you will fly, no matter what.
I'm pretty sure. I know that you have clients from around the world, China, England, South Africa, and whatnot. And these people are flying here for a particular reason, And again, some people will fly further because it's cheaper, but then, again, they don't get good results, right? And some people will fly further. In your case, they come here for good results, right? So like I mentioned before, my hairstylist introduced one of her clients to me because she told him that I had the best hair transplant results she's seen, and so he's contacted me, and he came to you, and eventually he went to somebody in Texas, which is further away and also cheaper.
And he couldn't wait for the long.
Right, he couldn't wait. The only reason, because he was so anxious, he likes.
Because I have a long
He liked
wait
the
list.
result. He loved my result. He thinks it's superior or whatnot. That's what he says, it's superior. And but then he could not wait. He wanted it done right away. So he didn't want to wait for another 6 months to a year. He decided to go to Texas, which is a little further. And the doctor said, "Oh yeah, I can fit you in this month." When he actually contacted the doctor said, "Yeah, I can fit you in this month," and he got a slot within that month, and it was cheaper. So he went to him, and unfortunately, his result wasn't great. And my barber said that, yeah, every time she sees him now, she goes, yeah, it doesn't look like he has any great growth or any density or whatnot. So that's another example of somebody that was a little anxious, and I personally thought that he should have waited.
Yeah. Well, people come to me not for price. You understand. It's the most important thing is they want to see how natural the hairline is, number one, and the density, and then but the consistency, right? Okay, if you subscribe to my YouTube channel,
Right.
and I upload every Friday, and if you see I produce good result every Friday, then it's consistent. Then the chance of you having a good result is high. Where some doctor posts one, and then 3 to 5 years he posts another one. What happened in between?
Yeah.
So consistency is important. Don't get discouraged about the wait list. If it'll take long, but there's a reason why people willing to wait for me long. It's the result.
Right.
Because this is your face. You can't. You be walking around with this. It's not a toy where you can cheap and throw it away.
Right.
You're gonna be living this for the rest of your life, and you want to do it right to begin.
Absolutely, you want to do it right, and Halloween. So Halloween passed, right? And I went to a Halloween party, and I was dressed up as a firefighter, and I had my firefighter hat on, and I met this girl, and we were talking, and then it was really hot in there, and I took off my hat, and the first thing she did was, "Wow, you got a really nice hair. You got a nice hairstyle." That's the first thing she noticed about me, as well. So it just makes me laugh and smile all the time.
But it makes you happy inside
makes me
too.
happy, absolutely.
Known as a hair guy.
Exactly, and they never say that. Hey, oh yeah, well you got a hair transplant, didn't you? Or did you get a hair transplant? You never say that, because I style my hair in a way where it best fits my face. I like it. Some people, I could part my hair in the middle or slick it back, but I find that combing it to the side, I like it the best. So you have to find the hairstyle that fits you the best. And the hairline, what you said, is very important, because the first thing that people notice is your hairline. If it doesn't look natural, then they're going to say, that's a hair transplant. But if it looks natural, no one can ever tell. And in my case, the 3 years that I've been with this hair, no one has noticed that I had a hair transplant. Well, no one that known me before said that I had a hair transplant, right? And in a lot of cases as well, there are some people that know that I was balding before, can't even tell.
Yeah. Well, I hope through Chris' experience that it give a glimpse of what hair transplant can be, and it's not just improve his image and brought back his handsome look and his youth, but it really it makes you happy inside. It brought your self-esteem, and it allow you to really move on with your life and do things that you want to do.
Right.
In your case, socially you were more happier.
Yeah. You notice today I'm a little bit more talkative or talking fast and slurring over my words. That's just because earlier I was tired, so I took a couple sip of coffee, and I don't drink coffee, so it's kind of making me like, oh,
jittery.
Right, and it's Vietnamese coffee, so Vietnamese coffee is pretty strong, so I don't drink coffee at all. But then I was like, oh, I'm kind of feeling a little tired. Maybe I should have a couple sips, and so I feel like I'm But it's another point that I kind of want to bring up to you too, Doctor, is that a lot of my friends, they ask me if I dye my hair, because
filler. How about that
fillers,
too?
right? So my hair, right? I don't dye my hair. I'm lucky when you transplant my hair, Doc, that I have no gray hair. So this is my natural hair color. But however, I was starting to get gray hair, so I kind of put Just for Men just to darken up here. But my hair, absolutely no fillers, no nothing.
No concealer.
No concealer. And why would I do that? I mean, come on, I don't need it, because the result's great. For one, and two, if you put concealers and stuff in your hair, it might kill your follicles or kill your hair or even clog your follicles. I don't do anything like that. I only take finasteride and minoxidil, and why not? Because you spend all this money on getting your hair back, so why not maintain it?
Maintain is good. Yeah, because I don't play games, so people want to make sure that this is real and this is all your hair, and absolutely there's no concealer on it. Thank you.